Hello, I'm Cindy Ehrenberg-Seltzer, President and CEO of the Children's Services Council of Broward County. Welcome to a special one-hour edition of Future First, Focus on Broward's Children. Our topic today is one that's very important to me, both personally and professionally, the prevention and eradication of childhood obesity. Over the last 3 decades, our lifestyles have changed, often for the better, but not always. The elimination of physical fitness programs from schools, a more sedentary lifestyle, and the preponderance of food high in calories but not necessarily high in nutrition have caused childhood obesity rates in America to triple. Today, nearly 1 in 3 children in America are overweight or obese, with numbers even higher in African American and Hispanic communities, where nearly 40% of children are overweight or obese. At this rate, 1/3 of all children born in 2000 or later will suffer from diabetes at some point in their lives, while others will face chronic obesity-related health problems like heart disease, high blood pressure, cancer, and asthma. Considering the human and medical costs, this is clearly an issue that affects us all. Besides establishing a nutrition and fitness task force, local community leaders have also embraced 2 national initiatives. First Lady Michelle Obama's Let's Move initiative, which strives to put children on the path to a healthy future during their earliest months and years. It gives parents helpful information and fosters environments that support healthy choices. It also pushes for providing healthier foods in our schools and ensures that every family has access to healthy, affordable food while helping children become more physically active. The second initiative, aimed at making communities healthier, is the Center for Disease Control's Pioneering Healthier Communities, implemented in partnership with the YMCA's nationwide. Here to talk about childhood obesity and local efforts to eradicate it are Dr. Paula Thatchy, a pediatrician who is director of the Broward County Health Department and chair of the Children's Services Council of Broward County, Andy Crawford, the director of community initiatives for the YMCA of Broward County, Mary Lee, an activist who recently traveled to Washington to address issues related to building healthy communities, and finally, Kirk Nelson, a chef and managing partner of Be Organic LLC. Later in the program, we will hear from Broward County Commissioners Eileen Lieberman and Dale Holness on countywide efforts to provide children with adequate nutrition and fitness opportunities, and Ben Wheeler of the Greater Hollywood YMCA Family Center on implementing new ways to encourage physical activity among children. Well, welcome everybody. Thank you so much for being here. This is such an important topic. Having struggled with my weight my whole life, my heart just goes out for these children who have become obese at such an early age. Paula, I want to start with you and talk a little bit about Broward County statistics. We heard about what's happening nationwide, but can you tell us about Broward?
Well, Cindy, as you said, in the United States, nearly 1 in 3 children are overweight or obese, and actually 17% of those are obese. This rate has tripled since 1980. Wow. In Broward County, according to Florida Charts, which is the Department of Health's data system, about 10% of our middle school students and about 10% of our high school students have a body mass index more than or equal to the 95th percentile, and this would put them in the category of obese. Body mass index is what we use to determine overweight and obesity in children, and this is calculated from height and weight, and then it's compared to children of the same gender and the same age. So a child is determined to be overweight if their body mass index is more than or equal to the 85th percentile, but less than the 95th percentile compared to children of the same age and gender, and determined to be obese if their body mass index is more than or equal to the 95th percentile compared to children of the same age and gender. So we obviously have significant issues in Broward County, along with the significant issues that are occurring nationally. There are also significant racial and ethnic disparities, as well as socioeconomic disparities with overweight and obesity. For example, in 2007-2008, Hispanic boys were significantly more likely to be obese than non-Hispanic white boys. And non-Hispanic black girls were significantly more likely to be obese than non-Hispanic white girls. With regard to socioeconomic status, 1 in 7 of low-income preschool children in the United States are obese, and this may be largely due to a lack of access to fresh fruits and vegetables in their communities and a lack of safe, accessible outdoor space in which to play.
Now, when Leia was born, my daughter, I talk about her a lot on this show. She's about to be 5, can't believe it. I was taking her to the pediatrician in those first years several times. They were always checking her height and weight and giving us guidance. Is that not happening in the low-income communities? Are we seeing that the kids are not going to the pediatrician as well to get that guidance?
I think access to health care is always an issue with respect to transportation, with respect to insurance and socioeconomic status. But pediatricians are a very important partner in combating childhood obesity, because one of the strategies is to empower parents and to give them the tools and the information and the support that they need to make the right choices for their families. And we really want to make the healthy choice, the easy choice, the default choice.
That parental choice issue is something really important, because I'm sure there are people out there saying, why is the First Lady getting involved in what I'm eating and what I feed my family? And we were talking a little earlier about why that is important. It's not government telling us what to do, but rather empowering families. Mary, you're involved in your community.
Yes, I am. And it, again, as you said, it's not about telling the individual or families what to do, but it's giving you choices. It's giving you tools to work with in the various communities, because we are concerned about the obesity of the children. You know, what are you eating? What are you consuming? What kind of products? You know, the sugars, the carbohydrates, and those types of things. So I can understand where Michelle Obama is coming from with, trying to lay out the do's and don'ts for us. But again, it's a choice that we have to make as families. That's a choice for the family to make.
And it's not about demonizing families.
Absolutely not.
I think that's a concern as well. I mean, some people are a little fluffier than others. But so we don't want to make people who have some extra pounds on them feel bad, but rather give them some tools to combat it. You have been very active in that.
Yeah, I mean, pretty much what we have tried to do is educate our community about living and eating a healthier lifestyle. The bottom line is we've noticed that there's a lot of, again, obese kids, obese parents, but the problem is not just that the kids don't have the resources, that the parents don't have the resource. Like the parents don't understand that you have to, take initiative. Like, in other words, we could tell the kids all day, eat fruits, but if they go home and the fruits are not there, are available for them, like you guys were saying earlier, then unfortunately, the same thing going to happen, the obesity, the overweight, and all this stuff. So what Be Organic, what we're trying to do is, with all of the catering companies, go out to the community, educate them, let them know, like, organic food, the first thing people hear organic food, what they hear is like, oh my God, grass, and it tastes nasty, and it's unhealthy.
It does, it compared to chicken nuggets,
exactly, chicken nuggets, So that's what we hear, but when we actually flavor our food and we give them to them, say, okay, you can have the same thing. Instead of fried chicken, you have baked chicken, okay? And it's still the same, it tastes good, it's still great, it's still, good for you, but it's healthier choice. So that's what we try to do. And we're, 2 years ago, we did a bike tour. And what we did was we rode bicycle around the entire state of Florida. We started from Miami all the way up to Jacksonville on bicycles. Not like bikes or motorcycles, but bicycles. We wanted to bring the message out to everyone. We touched over about 50,000 people, but we fed about, I think, 12,000 people, I believe. My numbers may be off, a little bit more than I'm saying. And we went to colleges, we went to churches, we went all over. Anywhere that would accept us, we went to, and we educate people and let them know that, it's the food that you're consuming at the McDonald's, those are the new things. The food that you're eating right now, those are the things that are causing these diseases, the high blood pressure, the cancers, the diabetes and stuff like that. So with Be Organic, we're just trying to give you a starting point. We're not telling that, hey, just because you're a little bit chunky doesn't mean that you're wrong. No, we're saying that everyone is a different structure, but if you put stuff in your body that makes you feel good and make you alive, that's where we are. So.
We're working with Paula as well on the Pioneering Healthy Communities initiative that you mentioned at the intro, and exactly what you said. How easy is the healthy choice? And we've really engineered our lives so that the healthy choice of getting more activity and eating healthier foods is actually the more difficult choice, the more inaccessible choice, and the more costly choice. And while we talk about individual choices, when individuals don't have those choices, or that choice is not accessible or affordable, is it really a choice? So the goal is not to tell people what to do, but to provide a choice and an opportunity, and maybe even nudge the healthy choice a little bit further. And certainly we want to do that with our kids, to say, certainly there's a room in your life for treats. But as we always tell our kids at the Y, unfortunately our treats have become our eats. Our eats need to go back to being our eats, and then your treats can certainly still be there. It's not about taking treats away, it's about putting them back into a treat area, whereas they've become an eat area.
Really good point. And when you're talking about framing the community so it can promote those healthy choices, the county and the county commission have a lot to say about that. So let's hear from Commissioner Eileen Lieberman on the county's support of the Let's Move initiative and what they're doing to promote healthy lifestyles.
The issue of childhood obesity is one that's affecting every part of our nation. Nationwide, there are about 3.7 million children, of which a third are considered obese before their 5th birthday. Early obesity in young children can be an indicator of high blood pressure, high cholesterol, or type 2 diabetes in later life. So being able to interact with children in their healthy living choices at an early age will help us manage and perhaps prevent some of those diseases. I am fully behind the First Lady Michelle Obama's Let's Move initiative because it starts early in a child's life. It involves their schools, their parents, people they see in the community about making all kinds of healthy choices. I am particularly interested in this issue because I think it networks with another initiative, which is the food deserts. You know, all too often children in low-income neighborhoods don't have access to fresh fruits and vegetables. And so the Let's Move initiative, which involves the entire community in getting involved in this, will also help bring more fresh food choices to the plates of young children. The county is behind these efforts because we think it's important to the health of our future adult citizens. But we'll be issuing a proclamation on September 13th of this year to proclaim Childhood Obesity Prevention Month. The lobby in the Government Center will have a display all about ways in which you can impact childhood obesity and bring the numbers down. And obviously I'd like to see a reversal in those trends, which unfortunately what we've seen is an increase over the years. In addition, our main library will have periodicals and other books that people can use as part of the outreach program. And we're looking at building partners with other groups who have the same issue at stake that we do. We need partners in this initiative. Of course, we need the schools. Many children have lunch at school 5 days a week and they need healthy choices. Some also have breakfast there, and we want to make sure they're getting healthy choices as well. We need stores, especially in our low-income areas, who will apply for food deserts and will help expand what they sell to fresh fruits and vegetables. We need all of our great not-for-profit agencies that interact on a regular basis with parents and children to help us educate the parents about the importance of making sure that there are better choices on the child's plate. The county wants to make sure that children have many places at which they can be involved in physical activities, and our park system is amazing for that. There's a full range of activities ranging from swimming to horseback riding to target range to skating. I mean, you can do anything just about in a county park. Residents should go to www.broward.org and click on parks to see all of the many offerings we have that help keep residents physically fit. In order to affect childhood obesity, it's going to require a concerted effort. Parents, children, community groups, schools all have to be involved. Not only with the Let's Move initiative, which gets people out of their chairs and working, but with food deserts, expanding opportunities to get fresh fruits and vegetables. In addition to that, we want to make sure that if someone wants to plant a community garden, that we have a space where they can grow vegetables as well. So all of these hopefully will come together so that we can impact childhood obesity in our county.